Hundreds of nurses in the East Bay are back on the picket lines for the second day in a row. They are on strike demanding better working conditions amidst the pandemic. KPIX5's Kiet Do was at the San Leandro Hospital where nurses have been calling on the management to hear their concerns.
This is day 2 of the nurses' strike in the East Bay. They are turning up the pressure, and it does not seem to be slowing down. At San Leandro Hospital, the action started well before sunrise.
Scab!
On the bus, outside workers brought in to cover the shifts of employees who were on strike. The 24 workers entered through a back door behind the ER and got an earful on their way in.
Scab!
I've been here quite a few years, and to see this is really upsetting.
Day 2 of the strike drew hundreds of people to all 4 of Alameda Health System's hospitals and also their clinics. SEIU Local 1021 says they've been trying to negotiate for the past 10 months and was disappointed to see management bring in the outside labor.
They spent $9 million and counting to bring in these replacement workers. You could have settled at the table with us and provided the things that we needed to just give our patients the safe care, and we wouldn't even have to be out here now.
The nurses demonstrated at the county building today to try and pressure the Board of Supervisors to intervene. They say understaffing has led to unsanitary and unsafe conditions at the hospitals. Needle bins overflowing, blood-spattered equipment left uncleaned, damaged walls, and electrical work left untouched for extended periods of time. They've had to discharge needy patients in dirty clothes, and nurses say they've been provided with these gowns. Look closely, and they say not for medical use.
That's not safe for us or the public. We're spreading around disease against our will without any way to get out of that situation.
Chapter President John Pearson says the county needs to take back control of the public hospital.
This is a broken system. Even before the pandemic, management would agrees with us. This is underfunded hospital system. Poor people, homeless people, people with complex medical problems, and that is not a money-making enterprise. But it is something that we need to do, and we need to be invested in that. And so the county needs to directly fund this.
With no agreement in sight, the union says the strike will continue through Sunday. In Oakland, Kiet Do, KPIX5.
AHS says while they're disappointed the unions called this strike, they encourage the nurses union to go back to the bargaining table.